are live on YouTube. We are live on Facebook.
Well, what's going on, everybody? It's Dr. Schilling bringing this week's Wednesday Wellness Minutes. Happy New Year to everybody. We're back. We're live. Last week we had a brief respite, including our PEMF video. Hopefully you guys enjoyed that. Give you a little better appreciation for PEMF and how one of the medical doctors that are most famous in the world right now, Dr. Oz, is viewing PEMF as far as the wave of the future. It's the medicine of the future. So if you have any questions on that, please let us know. This week we're going to be talking about heart disease or cardiovascular disease and things like that. A very misunderstood topic, so we're going to provide some insights on to three main causes of heart issues. There'll be a fourth one that's more related to your brain and how your brain and your heart connected and things like that. But let's first start off with some statistics. So cardiovascular disease is the second leading cause of death in this country. So if you think about that, that's pretty profound. There are millions of people dying from cardiovascular disease every year. 1 in 4 people in America has some type of heart condition. Now that could be high blood pressure, that could be pain in the chest, angina or something like that, as they call it in the medical world. But it can cause everything from fatigue, like if you know anybody who's had congestive heart failure, feeling that limited breath, if you will, that's holding you back. As a side note, one of the leading causes of back pressure on the heart is actually due to the liver. And the liver receives all the deoxygenated blood to filter it and get the toxins out before it sends it onto the lungs, to the heart, then to the lungs, and back to the heart, and then back out to your body. So it's a big circulatory system. But if there's stagnant blood in the liver and there's detoxification challenges in the liver, you're going to have a really hard time having a healthy heart. So keep that in the back of your mind. We'll be coming at you real soon with some liver information because Lord knows being exposed to 270,000 different toxins a day, it's really hard to stay ahead of the curve. It's a daily detox. It's not, once a year or twice a year kind of thing anymore. We want to appreciate that your detox process has to be daily. And your heart needs to be cared for every day. So keep in mind that medical drugs that are used to treat heart conditions are the third leading cause of death. If that didn't hit you hard enough in between the eyes. Third leading cause of death, okay? That's properly prescribed medical drugs designed under conditions to treat a person's heart condition, actually hurting and or maiming people. That's pretty profound. Never to be taken lightly. It doesn't matter what someone presents to you, whether it's a nutritional supplement, a medical drug, a surgery, something like that. Be very careful as far as what you're stepping into. Do your research, make sure you understand the risks and the benefits and the success rates for certain things, as well as the side effects, because side effects can be challenging. If you get a condition that has a drug to go along with it, you may have a side effect of that drug. You'll get another drug to go along with that. Next thing you know, you're 3, 4, 5 into it, and you're no better. You're actually worse off. They're really good at saving your life and keeping you alive, but they should not be used for long-term use, which is what our establishment is currently doing. Two of the main systems that they use to correct for heart disease are balloons, where they go in there and actually with a stent and they actually put a balloon in there and they open it up to get the blood flow going better. And or what they call cabbage, which I thought was really cute. The coronary artery bypass surgery. And if you've ever known anything about the medical world, nothing's cheap, right? Like you go to the hospital, you get some aspirin, it's like $5,000. And I'm probably exaggerating, but the cabbage surgery is $50,000, and that is probably outdated. It's probably $75,000 at this point. So just keep in mind that these things come at a cost. That's why our country is being bankrupt as far as Medicare and things like that, because all of the heroic measures to save people's lives come in the last 3 to 5 years of life, when their quality of life is already garbage, but we're dumping tons and tons of money into people that haven't taken care of themselves and now want to be saved as though they want to live, even though they've never lived up until then. So we're getting into some touchy stuff now, but keep in mind that a lot of our resources in our country is going toward these really invasive and really aggressive surgeries that are just extending people's lives by a tiny little bit, months to years, a couple of years, not like 20, like a couple of years. So it's really important we understand the impact of these things. As we talk about here all the time, prevention is the cure. And if you understand anything about an ounce of prevention is worth a pound of cure, just like anything, it takes about 7 times as much effort to recover from something as it does to prevent something. So just keep that in mind. We're happy to help you understand the preventive measures that are helpful. What's most important to understand is it doesn't matter if it's a drug or surgery, it doesn't get back to the root cause of what's going on with the heart and the circulatory system, the cardiovascular system. There's a lot of strong evidence relating to underlying infections associated with the heart and the heart condition and the cardiovascular system. Here specifically, we have found everything from human parvovirus to, I brought a couple of them out here, H. pylori, human parvovirus, cytomegalovirus, herpes simplex, a bunch of different viruses that are problematic for the heart. Now, everybody's different. Everybody's system is affected differently by these viruses and or bacteria, but bacteria play a big role as well. Strep scarlatinium, I think, is a breed of the strep bacteria that causes scarlet fever and heart cardiomegaly, which is increased heart size and things like that. So some of the things we use if we're not dealing with viruses or bacteria, because H. pylori, Helicobacter pylori is a bacteria, we use the DNA-based homeopathics to help the immune system learn how to deal with these microorganisms for the long term. It's as close to a potent vaccine as you can get without the toxic tag-alongs and adjuvants or the add-alons that they add in there. But we use things like Cardio-ND, we use Immunovent to balance the immune system, improve the circulation by Circuzyme, enzymes to help circulation. We have nattokinase, which is an enzyme to help clean out the vasculature, the blood vessels, because when they get sludgy and toxic and clogged, that's when you get more pressure on the heart. That's when valves start breaking down, things like that. Deltanol helps heal the lining of the blood vessels. There's things like nitric balance, which actually dilate the blood vessels. There are a ton of different things you can use from a nutrient standpoint that are going to benefit the person, right? You don't treat the heart as a condition, right? If you're born with a congenital so congenital means you're born with an issue. That's a fancy word, congenital. I was born with something, a leaky valve or a hole in my heart or something, whatever it is, right? Those can be challenging. They may require surgery depending on the extent of the injury or the problem as far as the genetic malformation. But there's a ton of stuff you can do to clean out the system. So the number one cause of heart challenges is mostly diet and lifestyle. It's forcing garbage down our gullet and getting inflammation, which then inflames our blood vessels, which then shrinks them. It's not cholesterol. The cholesterol theory has been debunked. It is absolute junk science. There's no legitimate proof that cholesterol has any effect on your cardiovascular system other than trying to repair it. Because if you understand you have about 100 trillion cells in your body, every single one of those 100 trillion cells uses cholesterol in some way, shape, or form. It might be a hormone backbone. It might be a structural sort of a scaffolding for your blood vessel. It is a carrier for a lot of different things. So every cell in your body is using cholesterol. So don't ever look at cholesterol. If your body produces it, which cholesterol does and controls it in a very tight band, it's doing it for a reason. So if you have elevated cholesterol, it's because your body's probably fighting off an infection and needs to build up more hormone and other immune markers to balance that infection. So please disregard the cholesterol heart disease theory because it's junk science. Up to 80% or more of heart conditions are related to infections that have been yet to be uncovered rather. I know preventricular contractions, PVCs, people have a lot of irregular heartbeats. They'll go in there, they'll do a sinus atrial node block, or they'll do some type of ablation where they go in there and try and burn out part of the nerve root in the heart to change the rhythm of the heart. I mean, this is just crazy stuff. It's amazing that the science has the technology to do it. But at the same time, at what point did anything involve going in with a needle and burning some type of nerve ending in your heart? I mean, you just have to take a step back and say, well, that's pretty intense. So if you're not uncovering the underlying infection and stress in the body and or addressing the diet and lifestyle by eating garbage food and getting our bodies inflamed, it doesn't matter how many times you go in there and ablate something, you're going to have some type of repercussion, some type of issue, because you're not dealing with the root cause, which is what we're dealing with here. Addressing the root cause. Antibiotics are well known to cause further heart challenges. Even one, maybe two uses of antibiotics can be problematic for heart conditions and or predispose you to a heart condition by imbalancing your microbiome. Again, we'll get back to the 100 trillion cells in the human body. We have 10 times that many. So if you take 100 trillion and multiply that by 10, that's how many molds, funguses, bacteria, parasites, and viruses you have living in you and on you. And why I mention that is because it is so important to understand that bugs are not your enemy, and imbalance of your bugs is a problem. And so that's why people can end up coming here, because all they're getting is antibiotics and antifungals and antivirals, but you're not supporting the body, you're trying to manipulate it. The whole goal we have here in our mission is to support the body and do its full expression of health and wellness. So you got to get to the underlying cause of that. Basically, you got to rebuild the nutrient systems in the body, get the vasculature, the health it needs, get the junk foods out in order to decrease the inflammation and get the gunk out of the arteries and things like that. That's the most important thing. You can use nutrients, you can use detoxes, you can use infrared heat, a bunch of different stuff as far as that goes. One of the last things we'll talk about is that a lot of the neuro-emotional stresses that go on in the body are affecting the heart. The main thing about the heart is overwhelm. You hear about people, get racing heart, anxiety and things like that. These are really, really common. And if you understand and appreciate that, basically what you want to know is if you're feeling an irregular heartbeat, it's most commonly associated with some type of stress that you have not acknowledged or not even aware is there. So these neuroemotional patterns can come in the form of feeling stabbed or betrayed, stabbed in the heart or betrayed, like someone really betrayed you, stabbed you in the heart. It can come from the smooth muscles in the heart, and that's an inability to nurture or an inability to love. That could be a family member, a friend, or something like that. It can feel like if you have an inability to feel, if you feel really like shut off and it's too painful to feel, that can be something associated with the heart. Then, of course, we get into the more volatile areas of the brain and the temporal lobe related to anger, jealousy, struggle, and then blaming others. So if you find yourself connecting with any one of these different statements, there's most likely some type of underlying neuro-emotional, neurological conflict in the brain that is manifesting in the body. What you want to appreciate is thoughts are the language of the brain, but emotions are the language of the body. You don't get butterflies in the corner of your head, you get butterflies in your stomach. You don't get grief in your jaw, you get it, or rather, let's go with your temporal lobe. You don't get grief in your temporal lobe, you get grief in your chest and your heart. It feels heavy, it feels like mourning, it feels oppressive. So all these different things can affect you, and there's no part of the body that can't be explained as far as the discomfort there. There's always a connection to the brain, and we can help you understand that. Just let us know what questions you have. So at this point, we want to just mention that diet and lifestyle, biggest cause. Infections and medical drugs are the three main challenges with heart issues. And then, of course, you have the least known of all, which is the underlying neuroemotional stresses. So if you can appreciate that, these are keys so you understand your heart and your cardiovascular system, and you can get to the point where you don't have to be dependent on pharmaceutical drugs. Amelia's trying to sneak by there. But you want to appreciate that there are simple answers. If you or someone you love is struggling with a heart condition or some type of cardiovascular disease, understand that diseases don't exist. Diseases are a collection of symptoms. Therefore, if you have a set of symptoms that somebody put their name on, like, hi, my name is cardiovascular disease, I'm sure there's some doctor out there with some cardiovascular disease that they have these set of symptoms and now their name's on that. But that's all they are. So if you go in there having these symptoms, they're going to put you in a box that has a label on it and they're going to treat you as such. And it's not that they're trying to hurt you, but that's what the medical establishment has developed as a standard of care. So if you get to the point where you're stable, and now you say, I want more out of life, I want to feel better, I don't want to take drugs for the rest of my life, that's when you have to make a decision. It's like the Matrix, like blue pill, red pill. Which one do I go? Which direction do I go? Which rabbit hole do I want to go down? So you decide, and you say, I want more out of life, I don't want to be beholden to drugs that are limiting my full expression of life. If they're saving your life, you stay on them. If they are no longer saving your life and they're simply keeping you stable, then there is a strategic way of weaning yourselves off of them and moving forward, getting yourself healthy and living optimally again. Please share this with your friends and family, some people you know with heart conditions, so they are more well informed about the underlying causes of why these things happen, and they're not just assuming that, well, my ticker's off and I better go get a pill, because that's not going to get you anywhere. If you need your life saved or kept alive, you definitely go see your medical doctor. When you're ready to transition off of medical drugs and live life fully, that's when you come see us or someone like us. Okay? Let us know if this information has been helpful. Give us a thumbs up or make a comment below with your questions, whatever it might be. Obviously, your case is going to be unique to yourself, but guaranteed other people are going to have similar questions and or want similar insights. Keep that in mind when you post that. Certain times people post on there and they're like, I had one woman comment on one of our posts the other day or last week said that's false advertising of some sort. Her contention was that we were somehow treating a condition, which we don't work with conditions. We help people express their true quality of life and their highest quality of life. We don't deal with conditions. What we're talking about here is words that people understand that resonate with them because that's what they've heard on television, right? Your most common exposure to any of this stuff is through ads on television for medical drugs. Therefore, we use the terminology they use so you understand that it fits in a certain category, but that within that category there are a ton of different things that it can relate to this. And ultimately, you got to get to the root cause. And putting black tape over a red alarm sign like a drug over a heart condition is not going to get you anywhere. But as I said, and I will continue to say, if you're dying or need to be saved and kept alive, you go see your medical doctor. When you want to deal with your quality of life, which is not medically necessary, that's when you come see us. So let us know how we can help. We're here to do that. Let us know what you want to post on, because our mission is to provide you with valuable information that can enhance your life, and your comments help us grow, help us evolve, and help us provide better information so that you are better served, because that's our purpose. We live in service of you, because that's why we're here. So let us know how we can help out, all right? Happy Wednesday. Happy New Year to everyone again, and we will see you next Wednesday for the Wednesday Wellness Minutes. And at this point, unless we're going to talk more about heart, we'll be talking about liver, because everybody's got one. It's probably the most unappreciated organ in your body, and we need to have you understand better how it works and how to clean yours out, because it's toxic. All right? See you guys. Have a great night.